Imagine you're a zookeeper. You're sitting at your desk in the office at the zoo one afternoon, and you get a call that a shipment of butterflies or fish or frogs is about to arrive. What's your first thought? How do I create healthy habitat for these animals? Knowing something about their biological and social needs, knowing some of the main dimensions of habitat, humidity, temperature, flora, fauna, hiding places, you get right to work. And over time, you'll monitor your success in one simple way. Are the animals thriving? It's remarkable how rarely we think about creating human habitat the same way. We build places for aesthetic reasons, for profit, for efficiency, all perfectly important motives. But we don't necessarily aim to build places in which people can thrive. Now, if we did want to do that, what would we be up against? This table shows the leading causes of death in our country. You can see that heart disease, cancer, and stroke top the list, followed by lung disease, injuries, and some other conditions. Another way to look at our health burden is not through mortality, but through disability-adjusted life years, or DALYs. DALYs measure not just death, but years of healthy life lost to conditions that may not be fatal. And on this list, you still see heart disease ranking high, but you also see diabetes, depression, arthritis, asthma, and other conditions. And here's the core idea. Bad habitat can aggravate or cause some of the thorniest health problems we face. But good habitat, designed with people in mind, can help prevent or control those conditions. Now, what do we need in our habitat? The answer is not too complicated. Clean air to breathe, fresh water to drink, access to healthy food, contact with other people. After all, we're a social species, but not too much contact. We need some privacy also. We need opportunities for routine physical activity. We need contact with nature and more. How are we doing at creating habitat that fills those needs? Well, over the last 50 or 60 years, our towns and cities have developed according to a pattern called urban sprawl. Sprawl features the expansion of cities across vast geographic areas. It features the conversion of land use from forest and farmland to residential development at the edge of cities. It features low-density land use. Instead of several families per acre, which was traditional in cities and towns, you may see several acres per family. And with these changes in land use, things are spread out, destinations are far apart, walking, biking, and transit become much less practical, and the automobile becomes our main means of travel. That means that a standard part of the human habitat becomes massive projects of road construction. But no matter how much road we build, we still spend large amounts of time like this. Traffic jams, quaintly called rush hour, as if it lasted only an hour at a time. Hardly an example of human thriving. Coming down to the neighborhood scale, we see the familiar loop and lollipop neighborhood design. This features low connectivity, difficulty of getting directly from point A to point B, and low land use mix, meaning broad swaths of purely residential development. So if you live in one of these houses and you want to visit a friend or grab a loaf of bread or a quart of milk or go toss a frisbee in the park, you're in for a car ride. Now, when we do build pedestrian infrastructure, too often it's an afterthought. It can seem insincere, poorly maintained, even painful. And what about our drive-through culture? You can drive through for your food, for something to drink, for all of your errands. You can drive through to pray. You can even drive through to get married, all without getting out of your car. It's almost as if some diabolical force had conspired to engineer out of our habitat one of our basic human needs, routine physical activity. Here's an example. This graph shows the proportion of American school children who walk or bike to school. The green bars on the left are 1969. The yellow bars on the right are 2001. So look at the middle of the panel. These are children who live within a mile of school. Back in 1969, 87%, 7 out of 8, walked or biked to school. By just 30 years later, that proportion had dropped to 63%, or 5 out of 8. On the right side, you see children who live within 2 miles of school. Fully half of those children walked or biked to school in 1969. Now we're down to below 1 in 5. That's a shame. Routine physical activity is one of the best preventive strategies we have, lowering our risk of heart disease, of many kinds of cancer, of gallbladder disease, of depression, of osteoporosis, and more. But good community design isn't just about physical activity. Car crashes are the #1 killer of young people in this country, and the risk of a car crash is far higher in places where people drive the most. Heavy traffic results in air pollution. Air pollution aggravates cardiovascular disease, asthma, and other conditions. What about civic engagement? It turns out that in the places where commute times are the longest, civic engagement or social capital drops to low levels. And that matters because social capital is one of our strongest predictors of long, healthy lives. Now, we do know something about how to design healthy habitats for people. Healthy communities feature density, mixed land use, connectivity so that it's easy to get from place to place, vibrant activity centers, and good pedestrian, bicycle, and transit infrastructure. So let me invite you to channel your inner urban planner, and let's reimagine a few human habitats. You've seen a barren intersection like this, a place that you would simply want to speed through to get to where you're going. How do we reimagine it? Well, first, let's put a building in that parking lot across the corner. It's a mixed-use building with commercial down below, residential up above. Now let's turn to the pedestrian infrastructure. Let's make wider sidewalks. Let's put in some shade trees and some good lighting. Now let's go for density. Let's do some more infill development, bring some life onto the streets, and this is now a healthy human habitat. Got it? Let's look at an old, failing inner ring shopping center. These are disturbingly common across the suburbs of our country. How do we fix this? How do we reimagine this? Well, let's put in some stores and bring them out to the street. And above the stores, we can put some offices. This is density and mixed use. We improve the pedestrian infrastructure with good crosswalks and with some shade trees. And now, for good measure, let's put some residential space above the office space so that the people who work in these stores and offices can choose to live near where they work. Less travel demand, less traffic, less air pollution, lower risk of car crashes, more time to be engaged in their communities. This is beginning to look like a healthy human habitat. Another feature of healthy communities is parks and green space. These are great venues for physical activity. They're great places to mix and mingle with other people. But not only that, we now have more and more evidence that contact with nature is directly good for health. A study in Pennsylvania showed that post-surgical patients recuperated more quickly and easily if they viewed trees out the window of their hospital room than if they viewed a brick wall. A study in Tokyo showed that elders living in green neighborhoods live longer and healthier than elders living in stark neighborhoods. A study in Indianapolis showed that children living in green neighborhoods gain weight more slowly and are less likely to become obese than children living in stark neighborhoods. Parks and green space are a part of healthy human habitat. But no discussion of human habitat would be complete without talking about buildings. We spend in the range of 90% of our time indoors. And buildings can be dangerous. When moisture gets into buildings, mold can develop, aggravating asthma and allergies. Radon can be entrained into buildings from the ground below if not adequately ventilated, raising the risk of lung cancer. Chemical exposures can be disturbingly common in buildings, from pesticides, from volatile organic materials, from cleaning agents, from formaldehyde coming off of building materials. Even in the furniture that we use in our buildings, flame retardants have been implicated as endocrine disruptors and threats to normal, healthy child development. Buildings have something to do with physical activity. Look at this glorious, iconic elevator, a monument to sedentary lifestyles, exactly the thing we don't want to be celebrating. Why not glorious, iconic staircases? A way to burn calories, a place to meet people, and a thing of beauty. You've heard of green buildings, buildings that are designed to be environmentally friendly and sustainable. Green buildings can also be healthy buildings, and there's no better example than right here in Seattle. This is the Bullitt Center, headquarters of the Bullitt Foundation, soon to open. The designers of this building specifically excluded 300 toxic chemicals so that the people in the building wouldn't be exposed to them. To do that, they had to create brand new materials by working with manufacturers. They put in beautiful staircases so that the people in the building will be seduced into walking upstairs. They put in large, beautiful windows so that natural daylight can come in, and believe it or not, the windows open so that fresh air can come in. They put in solar panels on the roof so that all the electricity in this building comes from clean sources, producing no pollutants that are dangerous for people's health. And outside the building, there is ready access to transit, There is plenty of bicycle parking, meaning that people can use healthy ways to get to work. And there's a park across the street, meaning that you can get your dose of nature when you need it. We know how to build buildings that are parts of a healthy human habitat. Great human habitat promotes health and well-being, sometimes more effectively and less expensively and with fewer side effects than even our best medications. And that's not all they do. These are environmental assets. They help conserve resources, they help produce clean air and clean water, they help reduce our carbon footprint. So as you travel around, as you move from your home to your workplace, to your school, to run errands, take a critical look at your built environment. Ask if it's a healthy human habitat. It ought to be. Healthy habitat isn't just for animals in zoos. It's for all of us. Thank you.